Welcome back students to the next class. In the previous class we have studied about homeostasis and control, that means how endocrine system controls and coordinates with body physiology to maintain a homeostasis, where we have studied about negative feedback and positive feedback loop. We have studied about the receptors and hormones, how the hormone concentration affect the receptor on the cell and how the receptor on the cell affect the hormone perception, that means vice versa. So, in this class we are going to study about various common disorders associated with endocrine system, or we will study about endocrine hormones and hormone related disorders. So, what is a disorder actually? Variations in the hormone concentration and target cell sensitivity have noticeable effect on the body. Yes, that is true. The effect of the hormone can be seen, but the important part is that if the hormone effect is abnormal, that means either one upregulated effect or downregulated effect, it is known as an imbalance, state of imbalance. In that case you can say it is a disorder or endocrine disorder. So, basically the disorder depends on two factors. One is hypersecretion and the second one is hyposecretion. Where I am talking about hypersecretion means increased secretion of hormones. When I am talking about hyposecretion means decreased secretion of hormones. So, these are the two factors you have to memorize or you have to remember, that hypo related to low level or decreased secretion. Hyper means high. Okay. So, hyposecretion is inadequate hormone release, tumor or lesion destroys the gland. In which condition the hormone secretion decreases? Generally because of a tumor which partially covers the gland or any kind of destruction to the gland. If the follicular cells or the cells which are involved in the secretion of the hormones are less, then less hormone will be secreted. Okay. So, that is the condition of hypersecretion. Head trauma affects pituitary glands. You all know about pituitary glands. So, a trauma affects the pituitary glands ability to secrete antidiuretic hormone, can leads to a diseased condition or a disorder. You can say it as diabetes insipidus. It is a it can leads to chronic polyuria, that means frequent urination will takes place. So, this is one example which shows what hyposecretion of hormone can leads to. And hypersecretion. Hypersecretion are the excessive hormone release, and tumors or autoimmune disorder can also affect our hypersecretion. For example, is your toxic goiter, Graves disease, antibodies mimics the effect of thyroid. So, we basically going to in detail we are going to cover about hyposecretion, related disorders, hypersecretion and related disorders. Now, first of all, as we know, pituitary is known as the master of endocrine glands. We have to study about different pituitary disorders. Okay. So, first highlighted one is your panhypopituitarism. Hypopituitarism means low level of pituitary secretion or low level of pituitary function. Pan means overall how the low level of pituitary secretion can affect. This term means decreased secretion of all the anterior pituitary hormones. Why? The majority of the hormones which controls the body activity or controls other endocrine glands are secreted from the anterior pituitary. That is why you can say that it is the term means decreased, the panhypothyroidism or sorry hypopituitarism means the decreased secretion of all the anterior pituitary hormones. Okay. And the cause is congenital or suddenly congenital, it can happen. Congenital means that is the problem is already there from the birth, and suddenly suppose sudden mutation or sudden destruction of a follicular cell or sudden destruction of portion of the pituitary can lead to decreased secretion, or slowly at any time during the life. Suppose a gradual tumor develops which covers the anterior pituitary or which inhibits the function of anterior pituitary, can lead to its gradual diminished function. Okay, so these are the cause. Now what happens actually when the pituitary secretion goes down? So number one is dwarfism. Dwarfism, if the pituitary secretion decreases during the childhood, the growth does not takes place properly, and that case we can say it is the dwarfism. So basically in case of dwarfism, you can observe by visually, you can see that though the proper age of that person or the actual age of that person is, suppose boy is at 10 years or a girl is 10 years, it will look like relatively smaller, like 7 or 5 years old. The symptoms related to dwarfism as or panpituitarism is that person or that boy, that girl will not attain maturity. That means adolescence will not be achieved. So puberty will be not achieved. Sufficient quantities of gonadotropic hormones will not be formed. So its proper gonadal development will not take place. So here in this diagram you can see this is the Little People Association in of USA, where there is one association. This the persons or the peoples who are suffering from dwarfism, they have a community. How they support each other. So this is simply this picture I have shown you. So I have shown here to know that how these dwarfism people looks. Next, hypopituitarism involves number one point is hypothyroidism, because thyroid is under the control of pituitary secretion, so it can leads to hypothyroidism. Depressed production of the glucocorticoids, as the adrenal glands is under the control of pituitary gland, adrenocorticotropin hormones. So glucocorticoids are secreted less, so it leads to suppressed secretion of suppressed secretion of the gonadotropic hormones, and that actually very much important for your secondary sexual characters or sex development. So okay, so thus the picture is that of a person who is suffering from panhypopituitarism will be looking like lethargic, is not gaining weight, and body metabolism is low, adrenocorticotropic and adrenocortical effect is low, as a result of which it shows a very lethargic person or depressed person. Its glucose level become imbalanced, the thyroid level is low, as so the basal metabolic rate becomes imbalanced, and the person lost all the sexual functions. So pituitary is very much important, and how the hormones are important you must have realized. Now deficiency of all anterior pituitary hormones is more common than individual hormone deficiency. So you should all remember that in most of the case the panhypopituitarism is common. So it can also affect two other hormones, that is your luteinizing hormone and follicle stimulating hormone, which are very much responsible in case of women. If the follicle stimulating hormone or luteinizing hormone secretion goes down, it results in infrequent menstrual cycle. That means the periods or the menstrual periods are not regulated properly, so it can lead to various further secondary complications. Similar way, men will lose facial hair, so which is one of the mark of secondary sexual characters. So the mustache and beard, they will not come. Okay, as well as the sperm count will decrease, so which ultimately leads to infertility. Similar way, if the anterior portion is also anterior pituitary is affected, or in case of panhypopituitarism, the level of growth hormone goes down, as a result of which decrease in muscle mass, central obesity. Though the muscle mass decreases, central obesity means the body proportion will be not in a proper way, so there will be trunk obesity. So impaired attention and memory. So for proper development, growth hormone is necessary. Your intellectual property, your everything, all need growth hormone. So if the growth hormone goes down, the person will be mentally retired, or it can, there will be another effect, it can lose its memory. And children experience growth retardation and short stature. The structure will be less. The children will not grow. Okay. So these are the various other complications. And it can also affect adenocorticotrophic hormone, which can leads to lack of production of glucocorticoids such as cortisol, and which leads to fatigue, weight loss, delayed puberty or adolescence, hypoglycemia, that means low blood sugar level, anemia, and hyponatremia, that means low sodium level. Okay. So these are the complications associated with adenocorticotropic hormone. Thyroid stimulating hormone, definitely the hypopituitarism also affect the thyroid stimulation. So the decreased thyroid stimulating thyroid hormone production, so it can leads to hypothyroidism. Typical symptoms are tiredness, intolerance to cold. So basically the basal metabolic rate goes up and down or imbalance. So then finally weight may gain, hair loss may takes place, blood pressure goes down. So it can leads to various complications. So these are the effect of hypopituitarism. So another hormone which remains is your prolactin. Prolactin plays a role in breastfeeding, and inability to breastfeed may point an abnormality low prolactin level. So basically it's a very complicated situation where if your baby is suckling, the breast is not breastfeeding, milk through the breast is not coming out. Why? Now because the hormone is not there, that is the prolactin level is very low. That is a very dangerous situation. That means it immediately should be treated with its hormonal treatment is required. So what we studied till now is all about hypopituitarism. Let's see about hyperpituitarism. Hyperpituitarism has always a devastating effect on the body physiology. So we should also know about what is the effect of hypopituitarism. So let's see acromegaly. This is one of the major abnormality in case of anterior pituitary secretion, that is the abnormally high amount of human growth hormone. What is the normal level of hormone production? If that normal level of hormone production goes up, as this complication happens. It actually happens, acromegaly happens in case of adult person after the adolescence is achieved, after the person become mature. Then if the level of growth hormone suddenly goes up, it can lead to acromegaly. What are the symptoms of acromegaly? Is the person cannot grow taller. In this case the person cannot grow taller because the person already attained maturity. The epiphyses of the bone are closed, so there is no chance of growth of bone, because we grow taller because our bones grow longer. That is important. So in this case the person cannot grow taller, but the bones can become thicker and soft tissue can continue to grow. In this case what happens, your bones become thicker, motta hejibo, and the tissue grows. So ultimately you will find a baggy appearance of your body. So that is significantly enlarged hand. In this diagram you can see this left one is your acromegaly. These two persons are of same age, same body actual age, but you can see the size of their hands. So it can the hand shows it is almost 2 to 3 times bigger as compared to a normal person. So significantly enlarged hands and feet. Feet you can see very webby feet. The feet are web like, dock like. So it becomes webby because it's unnecessary soft tissue growth. Okay, and the thickness of the bone is also high. So change in the appearance of the face. In this diagram, which I extracted from medical physiology book Guyton and Hall, you can see its appearance of the face becomes very unusual. That means its appearance changes. The muscles lowers down, all these things happen. Apart from that, there are also other complications like headache, visual problems, and it also associated with other diseases like your heart diseases, respiratory diseases, and even arthritis and diabetes. So, you know, as our growth hormone is very much essential for whole proportionate growth of our body as well as maintaining body metabolism. So, any disturbance to this growth hormone, if increased production of growth hormone can leads to various abnormal complications, which I have mentioned here. This acromegaly is very much specific to adults because the level of growth hormone goes up once the person attains maturity. Okay. The similar case, that means increased growth hormone production if happens in case of child or during childhood, it can lead to another disease or disorder. You can say it as gigantism. Or let us see that one. So, simply from the picture you can see there is nothing wrong with this person except the height. Visually, morphologically, you can see this is the normal people. This diagram shows they are the normal people, 5 and 5.5 feet tall. But see, the person is having gigantism, it's quite amazing, he is tall. So, a body tissue grow rapidly including the bones. The condition occurs before the aldostenes, before the epiphyses or the long bones have become fused with the shaft. The long bone has not fused with the shaft. In that case, if the growth hormone secretion goes up, the length of the bone increases abnormally, which can leads to a condition known as gigantism. It is also associated with other complications like hypoglycemia and other complications. So, we have studied the associated disorder related to anterior pituitary. So, let us see what happens in case if some hormonal disorder were associated with posterior pituitary or not. We have to see that. So, you all know from this diagram that this secretion of posterior pituitary depends on 2 points or 2 cellular portions or 2 nuclear portions, that is paraventricular nucleus and supraoptic nucleus. This paraventric and supraoptic nucleus are located in the hypothalamus and they secrete 2 hormones primarily, that is ADH and oxytocin, antidiuretic hormone and antidiuretic hormone or vasopressin and oxytocin. Oxytocin primarily secreted from the paraventricular nucleus of hypothalamus and antidiuretic hormone is secreted from the supraoptic nucleus of the hypothalamus. Okay. So, they are secreted and stored in the posterior pituitary. Now, let us see what is actually ADH. Antidiuretic hormone, it low the blood volume and low blood pressure, the antidiuretic hormone is secreted by low blood volume or low blood pressure. When the blood volume is low or the blood pressure is low, antidiuretic hormone gets secreted. Why? It helps in water retention and constriction. Its other name is vasopressin, constriction of the blood vessels. If the blood volume goes down, the blood pressure goes down. The low blood pressure stimulates the secretion of ADH from the supraoptic nucleus of the hypothalamus. The secretion of ADH ultimately acts on the renal tubules to retain water, to absorb water because of ionic balance, and ultimately the blood pressure is regained. So, how these hormones are important in body physiology, and definitely their hyper or hyposecretion can lead to disease. Similar way, oxytocin causes contraction of the pregnant uterus. So, it is also known as the hormone of parturition. Parturition, give birth to a child, the term is known as parturition. So, oxytocin is otherwise known as hormone of parturition. Okay. And it also helps in milk ejaculation or milk ejection. Okay. So, this is the function of oxytocin. Let us see. The ADH targets kidney to increase water retention and reduce urine, also function as a neurotransmitters. It also act as a neurotransmitter. It also reduce urination. Okay. Then similar way, oxytocin it helps in labor contraction, lactation, and possible role of sperm transport and emotional bonding between mother and baby. So, all these things are related to oxytocin. Now, let us see what happens. Diabetes insipidus, it is a condition which is related to antidiuretic hormone or ADH, which we have studied in the last slide. It caused due to insufficient production of antidiuretic hormone. It is characterized by excessive thirst and excretion. Okay, excessive thirst and excretion. So, what are the symptoms? Extreme thirst, blurred vision, okay, dehydration, extreme urination, fever, vomiting, diarrhea. So, various complications associated with the deficiency of antidiuretic hormone or ADH, and oxytocin deficiency generally cause few symptoms, as it is only required at the time of childbirth and breastfeeding. So, it is also very much confined to females, basically the persons which are ready to give birth their baby. So, in them or in those females, it is very much important to always scrutinize or monitor the level of oxytocin and other female hormones also. Now, let us see disease of the thyroid. Now, coming from the posterior pituitary to thyroid. So, this diagram I have shown you to simply give you a brief revision about how our endocrine system acts or what are the different portions of the major endocrine glands. So, see here you can see your hypothalamus, then attached is your anterior pituitary and posterior pituitary, then the anterior pituitary is really directly related to thyroid and parathyroid glands. This yellow color shows the feedback mechanism, this thyroid also give a feedback loop, and this is the portion or the cell which are involved in the metabolic activity and regulated by the thyroid hormone secretion. So, these are the loop. So, we almost know about endocrine system, and let us see now disease associated with thyroid gland. First of all is your hyperthyroidism. As I have already told you, hyper means the increased, thyroidism term is associated with the effect of thyroid gland. So, what happens if the thyroid activity increases? That means the thyroid activity is associated with various metabolic activity, the secretion, basically thyroid hormone secretion. So, what happens? The complications includes toxic goiter, thyroid toxicosis, Graves disease and various other complications. So, almost all we are going to cover first about Graves disease, and then we will cover about goiter. So, in most patients with hyperthyroidism, the thyroid gland is increased to 2 or 3 times to the normal size. Most of the cases, in most of the population, about 80 to 85% of the people, you will find that the hyperthyroidism is due to increased or enlargement of the thyroid gland, which is about 2 to 3 times. But it is not only the size increases, it is also associated with hyperplasia infolding of the follicular cell linings. How the gland basically increases? Because the thyroid gland contains some follicular cells. Those follicular cells actually trap iodine and they convert those iodine into triiodothyronine or tetraiodothyronine, which are known as the thyroid hormones. Then if the number of follicular cell increases, there is a chance that increased trapping. This is the purpose, but that actually does not happen in case of disorders. But in case of most of the enlarged thyroid gland, they found that, the scientists found that, or people have seen follicular cell lining into the follicles. So the number of cell increase greatly. The cellular content or the cellular mass of the thyroid gland increases abnormally. Now one condition appears, that is a Graves' disease. This is not apostrophe, it Graves then comma. Okay. So this is the right spelling of the Graves, this one. I am sorry for that mistake. So Graves' disease, basically this one is a autoimmune disorder. What is that? Where the thyroid is overactive, producing an excessive amount of thyroid hormone. Now how actually this happens? Basically, if the thyroid become overactive, then what happens? The overproduction of thyroid hormone can lead to some other complications. The main cause behind this is that autoantibodies. What are autoantibodies? In your level, I want to give you a brief introduction about antigen and antibody. Any foreign substances that enters into the body which can harm, which are foreign to the native state, those are known as antigens. So something invade to the body are known as antigens, and what is the mechanism, how the mechanism by which our body defends, our body acts on them are known as the antibodies. So antibodies, they are inside our body, they are the defense mechanism of our body, which you can study in your immunology section. But simply you understand that something which defends is called as the antibody, and if that antibody, instead of recognizing foreign substances as foreign, they recognizes these cells, the cells of the thyroid gland, or simply the thyroid stimulating hormone receptors. Thus they stimulate thyroid hormone synthesis and secretion and thyroid growth. What happens? The thyroid stimulating hormone is a hormone which binds on the follicular cells of the thyroid gland. Thyroid stimulating hormone coming from the pituitary glands, in normal situation, it binds to the follicular receptors and induce secretion of thyroid hormone. But in this case, Graves' disease, what happens? Though there is no thyroid stimulating hormone, these autoantibodies, they act as thyroid stimulating hormone, they binds to the receptor, they initiate the production of thyroid hormone without the presence of thyroid stimulating hormone. This is a autoimmune condition and what happens in case? The eyes may look enlarged because of the eye muscle swells and pushes the eye forward. If your eye muscle swells and pushes your bulbs out, you can see a enlarged eyeball. So weight loss in spite of increased appetite. So body appetite increases because the signal says that there is a deprivation of the food. So appetite increases, but the weight, you take large amount of food, but due to high metabolic rate you lose weight. So weight of the person goes down or it decreases, and this because of increased basal metabolic rate. That means the body activity is so high that the weight loses. So this diagram shows one person with Graves' disease. You can see how how her appearance. In a closer look, you can see how the eyeballs are bulged out. This is a pure condition of Graves' disease, and this basically happens in adults after attaining maturity. So what are the diagnostic tests? Diagnostic tests for hyperthyroidism is very accurate. Basically, you have to measure the plasma concentration of thyroxine hormone, nothing else, and this basically done by radioimmunoassay and other assays. So radioimmunoassay is a very particular assay which you will study in your higher classes. Okay. Now let's see hypothyroidism, that means decreased thyroid activity. Hypothyroidism. Hypothyroidism, like hyperthyroidism, is often initiated by autoimmunity. It can also get initiated by autoimmunity. Suppose the follicular cells, the antibody acts against follicular cell and damages the follicular cell and destroys, as a result of which follicular cells could not store or perceive the iodine to produce thyroxine hormone, as a result of which that there is a decreased metabolic rate, and it can this is called the condition called autoimmunity, and the name of the disease is called Hashimoto's disease or Hashimoto disease. And other disease associated with thyroid hormones are basically the thyroid goiter, which we are going to cover in detail. Several other types of hypothyroidism also occurs, often associated with development of enlarged thyroid glands called the thyroid goiter. The thyroid gland enlarges, that does not mean it secretes more thyroxine. So only the gland enlarges, so it is called thyroid goiter. So there are two types of thyroid goiters present. One is endemic colloidal goiter, which is caused by dietary iodine deficiency. If your intake of iodine is less, though sufficient amount of follicular cells are there, the cell cannot able to generate thyroid or generate thyroxine production, and does not able to produce thyroxine production. So endemic colloidal goiter is basically due to deficiency in dietary and iodine. If you are not intaking iodine, you will definitely suffer from endemic colloid goiter. The another one is idiopathic non-toxic colloidal goiter. The symptoms of idiopathic non-toxic colloidal goiter is exactly same to the endemic colloidal goiter, but its effect is quite milder, and till date no actual cause is yet revealed. कौन पाई हुए आज पर्यंत जना पड़ू ना. So these are the two figures which shows the endemic colloidal goiter and idiopathic non-toxic colloidal goiter. You can see this is a mild bulge, you can be seen, or bulge may not be seen in some cases in case of idiopathic non-toxic colloidal goiter, but in case of endemic colloidal goiter, or you can see how the thyroid gland enlarges. Sometimes surgery needed to remove a portion of the thyroid gland so that the person can regain its normal appearance, but this is not the permanent cure. So always there is intake of medicines or external thyroxine hormones required in this case, or in this case kind of disorders. So let us see hypothyroidism and its effect, consequences. Deficient iodine trapping mechanism. So these are the four mechanisms. One is deficient in iodine trapping mechanism. As I have already explained you, thyroid gland contains thyroid follicular cells. The follicular cells trap iodine to produce thyroxine hormone. If there is any deficiency in the mechanism of iodine trapping, that can lead to inadequate production of thyroid hormone or thyroxine. Then another mechanism is deficient peroxidase system. Why peroxidase system is important? Oxidation of iodine is very much required, in which iodides are if the peroxidase system is not there inside the cell, then iodides are not oxidized to iodine state. So the reversal does not take place, as a result of which accumulation of iodide leads to iodinated tyrosines. These are another amino acids, they get accumulated and ultimately lead to sudden complications. Then deficiency of the iodinase enzyme, that is also important. Likewise, peroxidase enzyme, iodinase enzymes are also required, which prevent recovery of iodine from the iodinated tyrosine. Once the tyrosine get iodinated, it should recover, because again the mechanism should go on. Unless until these 4 mechanisms are functioning properly, you can suffer from hypothyroidism. Now let us see 2 diseases associated with hypothyroidism. One is myxedema, another one is cretinism. I have shown this slide in a comparative way where you can understand what are myxedema, what are cretinism. Actually myxedema is quite similar to cretinism, but the difference is that myxedema happens in case of adults and cretinism happens in case of childhood or before attaining adolescence. These important points you have to remember. So, almost total lack of thyroid hormone function in case of myxedema, total loss of thyroid function takes place. In case of cretinism, extreme hypothyroidism during fetal life, infancy or childhood. Fetal life जेतेबेले पिला already womb भितर थिबो, infancy in birth ru किछि दिन भितरे, and childhood time रे भी cretinism can happen. Then in case of myxedema, the patient demonstrating bagginess under the eyes, bagginess ne आखि तळ सब फुलिकी ओळी पडथियो, bagginess under the eyes and swelling of the face, puffy appearance तुम पाइबो, तो मुह फुली जाइथिबो, all these things. But in case of cretinism, the condition is characterized especially by failure of the body growth and by mental retardation. In this case, intelligent level, in case of myxedema, intelligent level may not get damaged, but in case of cretinism, as it is a childhood disorder, the child intelligence level goes down. Then if you come to the what are the reason of myxedema and cretinism, under a broad term you can say that these 2 diseases or disorders happens due to hypothyroidism, but the actual reason of myxedema is not yet explained. Only you can say that greatly increased quantities of hyaluronic acid in the interstitial region leads to accumulation of interstitial fluids, which can lead to its puffy appearance or baggy appearance. In case of cretinism, it results from congenital lack of thyroid gland. पिला बेलु से छुआर thyroid gland रो गोटे पोर्शन नथिबो बा non functional थिबो, that can lead to cretinism. Now let us see another diagram of myxedema and cretinism. So from this diagram you can see how puffy appearance, this is the myxedema adult case, cretinism in childhood case. Here the intelligence level does not goes down, but you can see the lower portion of the eyes become baggy and the face become puffy appearance due to deposition of extracellular fluids. In that case the child become mentally retarded, and also there is some deformities in its appearance, but anyway this is more severe than this. Cretinism is more severe and more worse than myxedema. Okay. Now coming to adrenal disorders, which is in your course. So Cushing syndrome and adrenogenital syndrome, these are the 2 major disorders associated with adrenal glands. So now coming to the Cushing syndrome, in the right side image you can see, this causes hyperglycemia, that means increased blood glucose level, hypertension, the blood pressure always remain high, then which can lead to weakness and edema, mild edema and weakness. The muscle and bone loss occurs with protein catabolism. Catabolism means destruction, protein degradation. So the muscle bone loss, you all know, osteoporine and muscle रे जो भी any myosin किछि भी, those are the proteins. If those degradation of the proteins takes place, ultimately your muscle and bone will lose. So the person become puffy in appearance with weaker in strength. Another important point is that sometimes the face become moon face due to it's a childhood disease. The face become moon shape, fat deposition occurs, that's how its shoulder becomes bumpy. So it is also known as a buffalo hump disorder. So Cushing syndrome is sometimes known as moon face disorder or buffalo hump disorder. Similar way, adrenogenital syndrome, that is or AGS, here the condition is worse as compared to Cushing syndrome. What happens? The adrenal androgen hypersecretion leads to Cushing syndrome sometimes, but it is the major problem in case of children's, where their sexual organ do not mature, they do not attain puberty. They do not attain puberty. Then masculizing effect on the woman. In case of women, the voice become deeper, and sometimes what happens, the female also develop beard. So that is some of the disorders associated with adrenal gland. The most important disorder which we are going to discuss about is the Addison's disease. This is also caused by the deficiency of adrenal cortical hormones, that is cortisol, primarily cortisol, and associated with aldosterone also. What are the symptoms associated with Addison's disease is that fatigue, weakness, muscle loss, loss of appetite, weight loss, blood pressure is also low, then it leads to light headache or lightheadedness, then irritability and depression. It is also associated with some mild nausea and vomiting, and loss of cortisol. What is the mechanism behind this Addison's disease is that loss of cortisol secretion will lead to increase in adenocorticotropic hormone secretion, which leads to darkening of the skin. You all know that corticotropic hormones have effect on the skin coloration or due to deposition thickening of the skin, and this is actually called the Addison's disease. And if this disease persists or remain for more or become more severe, it leads to Addison's crisis. Okay. So this is the figure which shows the Addison's disease. The darker skin, the lip become thicker and darker, the skin become thicker and darker. So even though this kind of darker skin is not even in the history of their genetics, their family, but the person suddenly develop this kind of effect due to a hormonal deficiency, which is called the Addison's disease. Now let us see how this endocrine system control the fuel mechanism. As we have already understood that hormones are very much necessary for the homeostasis of the body. Without hormone, our body may fail to function. So hormones are very important, and they are the main fueling mechanism. The mechanism behind the fueling and giving energy to the body remains with the endocrine system or the hormones. So let us discuss about point by point what are the fuel metabolism. Metabolism is also called as it is a summation of anabolism and catabolism. Anabolism basically the constructive way of body molecule formation, and catabolism is how the body molecules get destroyed or degraded. So these are, and metabolism includes two parts, one is anabolism, one is catabolism. So metabolism is all of the chemical reactions within the cells of the body. Anabolism is the synthesis of larger organic molecules. Catabolism is the breakdown of larger molecules. Normally the rates of anabolism and catabolism are in balance in adult state. If the amount of substance formed is not cope with the amount of substance or the larger molecules breakdown, your body become imbalanced. To maintain a balance between anabolism and catabolism, it is very much important, and hormone has a major role in this. Nutrients from meals must be stored and released between meals. The brain needs a constant supply of glucose, because brain could not store glucose or glycogen. So it needs a constant supply of glucose. So one of the important aspect is another gland, specifically the islands of Langerhans, the pancreas. Pancreas is also known as both endocrine and exocrine gland. So, as we are studying about the endocrine gland, we should discuss about pancreas very little. So, pancreas having certain portion of the cells known as islets of Langerhans, those contain beta cells which actually secrete insulin. Those are the endocrine part, beta cells. So, insulin is secreted from pancreas, and the deficiency in insulin leads to diabetes. Okay. So, diabetes are of two types basically, type 1 diabetes and type 2 diabetes. This is different from the diabetes insipidus which we have studied earlier. Diabetes insipidus is related to antidiuretic hormone, it is related to the retention of the water, it is related to the blood pressure. So, diabetes insipidus is different. So, this diabetes is related to insulin, that is called type 1 and type 2 diabetes. Type 1 diabetes is around 10% of our population is having type 1 diabetes, and this is caused basically due to a autoimmune destruction of the beta cells. If the beta cells are destroyed, there will be no insulin production and it can lead to a type 1 diabetes. Some of the beta cells are destroyed, okay, and this destruction happens at the age of 12 actually, that means just before attaining the puberty. So, what happens? This can be treated easily, they treated with diet, exercise, monitoring, blood glucose and periodic injections of the insulin and insulin pumps. Okay. So, this can be manageable. So, type 1 diabetes is not that much disastrous as compared to the type 2 diabetes. This type 1 diabetes is also known as IDDM, IDDM, insulin dependent diabetes mellitus. Okay. This depends on insulin. Then what is NIDM? Non-insulin dependent diabetes mellitus, that is type 2. It is actually 90% of the population is having this diabetes. This is a disorder in the signal transduction pathway. The body become resistant to insulin. So, if insulin will not bind into the cell surface receptor, glucose will not enter into the cell and ultimately ATP or energy will be not producing inside our cell. So, that is the case called the type 2 diabetes or the NIDM. So, let us see, three major factors are hereditary, age and obesity. That part is hidden. Age, hereditary and obesity, or hereditary, age and obesity. These are the three factors which are associated with non-insulin dependent diabetes mellitus. Then how it is treated? It is treated with weight loss program, diet, exercise and oral medication, that means oral administration of insulin or that is targeted insulin injection. So, this is also manageable. So, nowadays insulin disorder is not a major problem because the modern science is able to manage, or modern medical science is able to manage insulin deficiency. So, next is what are the pathophysiology of or pathology of diabetes. Let us see, it has two pathology, one is acute, one is chronic. Let us first see acute pathology. The cells cannot absorb glucose. Number one is cells cannot absorb glucose. The body daily depends on fat and proteins. So, if the body does not absorb glucose, then body will shift for other mechanism how to convert other products into glucose and ultimately energy. So, body depends on fat and proteins. So, as a result of which weight loss happens, weakness happens. If your body loses weight, you will feel weak. If your body not properly produce ATP, you will feel weak, and as your body is utilizing fat and protein instead of glucose, definitely weight loss takes place. Okay. So, fat catabolism increases, ketonuria promotes osmotic diuresis and loss of sodium potassium channel. Why? Now, as your body is regularly utilizing proteins, so there is a chance their body can produce ketone bodies. When you study about urea cycle, you will come to know or liver cycle, you will come to know that what are ketonurias. So your body urea ketone bodies will be formed, so it can leads to ketoacidosis, and ketoacidosis leads to decreased blood pH level. If the acidic concentration of your blood increases, definitely the pH goes down, because you all know that in a pH scale, if the pH increases, the basicity increases, if the pH decreases, the acidity increases. So chronic pathology, in case of chronic condition, what happens? Chronic hyperglycemia leads to neuropathology, and cardiovascular damage from atherosclerosis is also happens in case of chronic pathology. One is atherosclerosis, one is arteriosclerosis. You must have remembered that one, arteriosclerosis and atherosclerosis. So go through that one and read. So cardiovascular damages basically associated with atherosclerosis. So retina and kidneys, which are the common problem in case of type 1 diabetes, they get damaged. That means atherosclerosis leading to heart failure, which are the common in the type 2 diabetes. So type 1 diabetes, basically it affects retina and kidney. Type 2 diabetes affects heart failure and atherosclerosis. Okay. So this is all about what are the pathology of diabetes. Then we have to see about what is hyperinsulinism. This is the one of the most case which patients suffer, that is from excess insulin injection can lead to hypoglycemia. Excess insulin injection leads to hypoglycemia. That means your cell receive or withdraws all the glucose from your bloodstream, but they cannot utilize that one. So ultimately you become hypoglycemic. So higher insulin injection or pancreatic islets tumor. Pancreatic islets tumor means if tumor happens in the beta cells or anything happens to the beta cell, as a result of which the insulin production goes up, it can also leads to the same situation like giving insulin injection to a person. Okay. So it's caused hypoglycemia, weakness, hunger, triggers secretion of epinephrine. This is one of the another trigger mechanism, that is one hormone affect the another hormone secretion, you all know that one. So production of higher insulin can trigger the secretion of epinephrine, growth hormone as well as glucagon. Epinephrine, growth hormone as well as glucagon. So what happens if the production of epinephrine, growth hormone and glucagon increases? The side effects are anxiety, high sweating and high hormonal response. So overall the body responds in a dramatic way towards the hormone, where the response towards the hormone for the cell increases drastically. As a result, the person can become faint. That is called insulin shock. That is uncorrected hyperinsulinism with disorientation, convolution and unconsciousness. So if you give insulin production to a person, insulin hormone injection high level to a person, it can leads to insulin shock. That can happen naturally or artificially. Naturally, if there is a tumor in the islets, or artificially if somebody take insulin in a more amount, that means in the form of injection, or it can happen in a high insulin tablet. Okay. So this is all about hyperinsulinism, and thank you all. So we have already covered the endocrine disorders, and thank you for listening in patience. Thank you.